I'm Seth Drobick. I'm in the Division of Adult Reconstruction and Joint Replacement at the Hospital for Special Surgery. I see patients of all ages. Typically they're people who require joint replacement, so hip or knee replacement, partial knee replacement. But I have actually a pretty large pediatric population, particularly because I do a lot of hip dysplasia, but also see patients of all ages. Patients with avascular necrosis, which can happen anywhere from adolescence all the way up to adulthood, and then also degenerative conditions like hip and knee arthritis. Yeah, my approach to patient care is very individualized. Even though hip and knee replacement seems pretty routine, everybody's a little bit different. So there's different shapes and sizes of bones, and I try to take a very customized approach to joint replacement. So enabling technology, which includes computer navigation and robotics, really allows us to customize the surgery to the patient. So traditionally we used to use kind of more manual techniques, and we're kind of doing the same surgery for every patient. Now we can actually get some information ahead of time. A lot of times I'll get a CAT scan ahead of time, three-dimensionally model your hip or your knee, and then use CAD imaging, computer-assisted design imaging, to put in implants, and then actually run them through a range of motion and determine a patient's function even before we do surgery. Practicing orthopedic surgery, particularly hip and knee replacement, is extraordinarily gratifying. I get to come to work every day and take care of patients, but when they come in, oftentimes they have pain, they're disabled, they might even be in wheelchairs, walkers, what have you. And then to be able to see them come in, the 6-week visit, the 3-month visit, the 1-year visit, and just see how they improve throughout their episode of care and giving people their life back, it's what gets me up every morning. It's an honor.